Hello, thanks for joining us on our online public forum on living well with epilepsy. I'm Dr. Tan, I'm a consultant neurologist, and today we're going to talk about what epilepsy is. Before we talk about what epilepsy, we should be familiar with what a seizure is. So seizure is one of the terms that's commonly used interchangeably with the term fit. So if a patient is described to be having a fit, it may be referring to a seizure event. Regardless, what a seizure means is a sudden episode of excessive hypersynchronous discharge of electrical activity involving the brain structures. It can involve the areas controlling our motor function, the areas controlling our consciousness, our speech, language, and of course, our awareness. And because of that, it can cause a huge constellation, an extensive constellation of signs and symptoms, from things that are more dramatic, such as generalized tonic-clonic seizures, or known as grand mal seizures in the past, to things that are more subtle and more innocuous. And it is this second group of patients that can be really difficult to recognize and diagnose, even by a seasoned epileptologist. Importantly, we should understand that a seizure refers to that clinical event of seizure, of the excessive synchronous discharge of the electrical activity over the brain, whereas if a person is described to have epilepsy, then that person has a disease or a condition that predisposes him to recurrent seizures throughout his lifetime. So that's the difference. Epilepsy refers to a disease, where seizure refers to that clinical event. Unfortunately, epilepsy is not that uncommon. Based on a recent census by the World Health Organization, with as many as 50 million of patients worldwide, it's probably more than that, who have been diagnosed with epilepsy. Contrary to what some of you guys here may think, that epilepsy is a disease of the young, based on the figures, epilepsy can affect patients of all ages. Regardless, if seizures and epilepsy is not well controlled, the risk of premature death can increase up to threefold more than a person without epilepsy. Worryingly, epilepsy or patients with epilepsy have to face stigma and discrimination with regards to their work life, their social life, and even in their families. With epilepsy being so common, what are the potential causes? So first and foremost, structural abnormalities, one of our predominant concerns when first facing a patient with the diagnosis of epilepsy. These structural abnormalities can include tumors, scars, previous strokes, brain injury, etc. Infectious causes can also cause a person to have epilepsy. This includes more common things like viral encephalitis, to things that are rarer, more obscure, such as prion disease. Immune-mediated causes of epilepsy is increasingly recognized. The causes are increasingly recognized, beg your pardon. This occurs in patients who have dysregulation or disharmony of their immune system. What happens is that antibodies are being produced that attacks the normal structures of the brain, resulting in inflammation, damage, seizures, and subsequently epilepsy. Metabolic and genetic causes have been well described in literature, but more worryingly is that despite extensive investigations and advancements in medical diagnostics, up to 50% of patients with epilepsy will have no known cause. 50%. In patients with epilepsy or suspected to have epilepsy or had a recent seizure, you may find yourself undergoing a few tests. One of the commonest tests being performed in patients who is suspected to have epilepsy is that of a magnetic resonance imaging of the brain, also known as an MRI scan. An MRI is a high resolution, very detailed snapshot of the brain. What it does is that it provides us information, it provides us with pictures to look for structural abnormalities such as tumors, strokes, scars from previous brain injuries, etc. So it is an important step in our investigative workup. Another test that a person with seizure or as person suspected of having epilepsy may undergo is an electroencephalogram, or EEG in short. So what this test does is non-invasive, usually. So what this test does is that surface electrodes are placed on the scalp, and hopefully through that, they can detect and characterize the brain waves reaching the scalp, reaching the electrode. And in patients with epilepsy and patients with seizure, it is hoped that through this test, we can pick up the electrical abnormalities, and as such, aids us in the diagnosis of such patients. However, a large majority of patients with seizures or suspected epilepsy may have normal EEG. An a usual routine EEG lasts only about 30 minutes. So in such scenarios, where the clinical suspicion of you or a person having epilepsy is really high, you may find yourself undergoing multiple extended or continuous EEG studies, sometimes even with videographic recordings. This is to help your physician make the decision whether that patient truly has epilepsy or not. The treatment of epilepsy relies heavily on lifestyle modification and medications. In terms of lifestyle modification, rest is definitely important. So things that can cause you not to have ample rest or disturbs your rest would be things like shift work, sleeping late, or sleeping very little due to other work, social commitments. Compliance to medication cannot be understated. Avoidance of high-risk activity is important. You want to avoid activities that give you too much excitement or place you in a position or a vulnerable position of harm, which we will discuss later. Medications are also important. The selection of medications depends heavily on the patient's age, the type of seizures, type of epilepsy, the other medical conditions that the patient has, and the side effects that the patient experiences from these medications. This requires an open discussion, continuous communication with your physician, so that the best and most effective medication can be administered and started at the lowest possible dose to avoid side effects. Increasingly, surgical treatment of patients with epilepsy is this in thing these days. However, this selection of patients who are suitable for surgical treatment of epilepsy is very stringent and very extensive. So what these surgical procedures entail, they include resection of the offending part of the brain, the culprit lesion in short, to implanting foreign devices, external devices would be a better term, than to hope to control the seizure frequency and allow the patient a certain degree of seizure freedom after the surgery. It's not for everyone. Again, the selection process is very stringent. What can you do when you encounter a person with seizure, and more specifically convulsive or generalized tonic-clonic seizures? First and foremost, while the patient is seizing, move objects away from the patient, things that can potentially harm the patient. That includes chairs, tables, even simple things like cutleries should be moved away from the patient while the seizure is still ongoing. If you have time and a watch, try to time the seizure as best as you can, because if the seizures last longer than 5 minutes, it is very important that you call for the ambulance. After the seizure has stopped, place the patient on his or her side. This is to prevent the tongue from falling backwards and occluding the airway. This also allows vomiters to exit the mouth from the side rather than it falling backwards into the windpipe, into the airways. What you have to avoid would be this. Putting a spoon into the mouth has been entrenched in a lot of cultures, largely driven by movies and what we see on TV. But this is one of the worst things you can do to a patient who's having a seizure. By shoving an object that is hard, solid, into the mouth, can risk further injury to the tongue rather than to protect the tongue, which is usually why the people in the movie would put in a spoon into the patient's mouth. So do avoid this as best as you can. Additionally, refrain from restraining the patient. Why is this important? Because when a patient is having a seizure, when a patient is having generalized tonic-clonic seizures, the movements can be really strong and powerful. Should you try to restrain the patient, you risk injury to not only the patient through dislocations and bony fractures, muscular injuries even, to injuries to yourself. The patient can accidentally hit you or injure you during the seizure if you try to restrain them. So do avoid these two things. Say again, do avoid restraining the patient and do avoid putting things that are hard and stiff into the patient's mouth. I beg your pardon, don't put anything in the patient's mouth. I'm going to address a few misconceptions from here. First and foremost, some of my patients think that they cannot exercise if they've been diagnosed with epilepsy. This is not true. Patients can continue to exercise safely. However, high-risk activities should be avoided. High-risk activities include snorkeling, diving, climbing heights, etc. The general theme is that if you are engaging in an activity, during which when you have a seizure and rescue cannot be immediate or fairly soon, this activity should be avoided as best as you can. Additionally, if rescue cannot be administered as soon as possible while you're engaged in these activities, the risk of death is very high. You may drown from snorkeling when you have a seizure while doing that. You may fall to your death if you're climbing heights, such bouldering activities, for example, if you have a seizure. Swimming is a bit of a, it's not that strict, to be honest. If you really want to swim, generally swimming should be avoided as best as you can. But if you really want to swim, and it's an important part of your life in terms of its quality, you can still swim. But I guess it is strongly encouraged for you to inform the lifeguard on duty that you are a patient with epilepsy. This is so that the lifeguard can pay a special attention to you, so that if a seizure does occur, then he can be there to rescue you in a very timely manner. Additionally, try to swim at the side of the pool, on the side closest to the lifeguard. This is again to facilitate your rescue should things happen. Avoid the deep end as best as you can, again for the same reasons. You can also continue to work if you have epilepsy. However, some work duties should be avoided as best as you can. So driving vocationally is one of the things that's, it's entrenched in our Road Traffic Act, actually, for consideration of road safety. If you drive vocationally, such as a bus driver, for example, or a pilot, as an operator, you operate a vehicle that has a lot of passengers, what happens is that should you suffer an episode of seizure while performing your duties, the risk of injury to members of the public, to people in general, is very high, and this kind of duties must be avoided as best as we can. Operating heavy machinery such as cranes, for example, or machine work. So this activity should be avoided again because of the risk of injury to yourself and to your limbs and to people around you should you suffer a seizure. Handling injurious chemicals includes handling hot oils. If you are a chef with epilepsy, or you have to, or cook, or assistant in the kitchen and you have epilepsy, you have to speak to your management, and you have to find ways to either protect yourself in terms of protective gear, or to remove yourself from situations that frequently places you at risk of being injured by this kind of chemicals or this kind of hot oil should a seizure occur. Similar to the no diving, no snorkeling advice earlier, working underwater, such as a diver, a salvage diver, for example, would be activities that I will strongly discourage a person with epilepsy from engaging in. There are more activities, of course, there are more duties, more occupations that should be avoided, but this involves a discussion with your physician, with your doctor, because not all activities are the same. I'm sure there are some nuances or intricacies. It is best that you discuss with your doctor so that your doctor can better understand your individual work scope and they can advise accordingly henceforth. You're not alone if you have epilepsy. Famous people can have epilepsy. In fact, right here we have an American president. We have a pawn shop owner, very famous, and we have Elron and Mr. Anderson here on top right-hand corner. Susan Boyle most recently. Why is this slide important? Well, there's still this misconception that patients with epilepsy, because of the condition, they can't function well, they can't thrive in society. This is wholly untrue. If the seizures are well managed, if the underlying condition is something that is not incapacitating, for example, brain tumors, right, then the patients can still potentially continue to lead a productive, thriving, highly successful life. As how Little Wayne puts it, all you have to do is to be compliant with medications, rest and eat well. That's about it. In Singapore, if you have epilepsy, there are help groups around that can help you with the care of a patient with epilepsy and to help you understand your condition as a patient with epilepsy. The Singapore Epilepsy Foundation and the Epilepsy Care Group Singapore, they do provide educational sessions, seminars, they do provide pamphlets, they have online resources that you can utilize to better help yourself, to better understand the care of a patient with epilepsy, and for patients with epilepsy, better understand your condition and the things you have to do and things you have to avoid to help bring some degree of control in your condition. With that, I end my talk and I'm open to any questions. Thank you.